How impactful is weight on PAH?
I don't know that we per se feel that weight plays a huge part in whether someone's PAH is, better or worse. I think that like many things, we would like to have sort of a pretty steady weight. So if we're talking about weight, and I'm going to describe this in two ways. If we're talking about weight as what we think of as tissue weight, right? So just like what is on our body, whether that be muscle or fat or skin or whatever makes up what we weigh. Being obese uh, can put more strain on the body. It isn't necessarily going to worsen your PAH, but other things come from potentially being obese, where we might more frequently see things like sleep disorders. You may have other types of medical conditions related to it. Being underweight, that obviously can also impact someone's overall nutritional status and how they do. But if we're talking about weight when it comes to fluid weight, and that's often when we talk about PAH, we're talking about the changes in someone's weight and those fluctuations day to day. It isn't usually because we ate the extra like piece of whatever or had a hamburger the night before. It typically is because maybe we increase the amount of sodium intake, therefore the amount of fluid we're retaining is increased. So we look at weight in PAH more as if you are gaining over 2 pounds over, sort of a 24-hour period. So I tell my patients, hey, if you went up 3 to 4 pounds in a day, that's probably fluid weight. If over the course of a week you went up by 5 to 7 pounds, again, that's probably fluid weight. So that may be an indication to give your provider a call and say, I think I'm retaining some extra fluid, my weight is increasing, and we may need to adjust some of the medications related to helping you, get rid of that extra fluid weight. So I think very meaningful to discuss. Are we talking about the tissue weight or are we talking about the fluid weight? And how might we impact those differing things?